presentation. Over to you, Nilesh.
Yeah, thank you, sir. I'll just
So he's going to talk upon fixed cost in a low profit setup.
so thank you, the AIO Scientific Committee, for providing UOC and me this opportunity. Actually, my talk was on high fixed cost setup, but when I saw the list of speakers, there are two components of it. One is the instruments that we are buying and the EMIs that goes for it. So it is one part which Jignesh sir has covered, and other is the value-added services in a low-profit setup. So I work in a tier 3 city where we have a population of around 2 to 3 lakhs, and a area that we cover is 5 kilometers. The entire city is of 5 kilometers. But luckily, the neighboring districts don't have such good setup. So we have a drainage area of around 200 kilometers. And that's how we started building it up. There is a second generation practice. I joined my father 2 years before. So what is a value added service? It is defined as something that is beyond your core service. Our core services are OPD and IPD services. So that is the core service that we have. Apart from that, there are the value added services like the OPD appointment, how easy you can make it for your patients, how the ambience that you are giving to your patient, and much more than that. And then there are in-house and then outside the house, like if the patient can book their appointment on website through a call center. If you are calling them for follow-up, reminding them that they have to come, they have to put drops, something like that. That is overall value-added service. So which each of them comes with a cost, and we have to calculate the cost. So I'm not going to tell about all the initiatives that we have taken, but I have chosen 3 examples for this. So the services that you want to offer, there are plenty. When you go to any hospital, any big hospital, corporate hospital, as Kushagra was telling, you see there are so much to offer, and you think that you want to offer all those to your patients. But what amount of all those services the patient needs actually, and is that service improving your turnover? So when all these 3 points hit, that is the value added service that is fit for you and fit for your practice. So let's discuss some bottlenecks. Say in appointment, we had my father, because he used to see only 20-30 patients per day, so he had a waiting time of 2 months, and patient had to come to our hospital, take an appointment, go back and remember that there is an appointment, because there was no reminder, no SMS. It was all written on a chit and given to them. If they lost the chit, their appointment is gone. Sometimes they used to forget that there is an appointment after 2 months, and there was a lot of hodgepodge that used to happen. Apart from that, I think everyone will be feeling billings, accounts keeping, health record keeping, everything has some bottleneck. So we have to identify the pain points. So in value-added service in OPD appointment, what I introduced first, even before coming, was a website appointment. A website I made on Wix costed me around 800 rupees and a Razorpay gateway. And I opened up a slot, of 1 hour slot for my father. So it was all automated. And when the patient used to search on Google who is the best ophthalmologist, because we had a website, it used to come. And then on the website only, they can book appointment, pay. So we were sure that patient is coming. They were getting automatic reminders. And most of the patients whose son or daughter is in Pune, Bangalore, Chennai, they used to book appointments for them. Then when I joined, I started a call center, dedicated 1800 number, which is costing me 70,000 rupees per month. But what it does is, now most of my appointment, we have a drainage area of now 5 districts. From 3, we have improved to 5. Even from UP, we are getting patients because they can call up, get an appointment. They get a time. You have to come at 11:05. So they come at say 10:45. Less waiting time. We also have free space, so we are catering to more walk-in patients right now. One day before the appointment, the call center calls them up, reminds them that you have appointment tomorrow. So if they want to reschedule some family emergency, they have to cancel. It becomes very easy for up, and they also follow up on the patient. If anything we want to do, we just tell them that you call up all the surgical patient in last month and ask how they are. So they do that. So that is worth it, and it has improved. Now coming to in VAS in OPD, I bought a machine that was costing me around 70 lakh rupees. It's Claris 700 wide field imaging. But when I saw the patient had to wait 4 hours in my OPD, and most of the time was them waiting because they had to come ARNCT optometrist, then wait time, then primary examination by consultant, then dilatation time of 1 hour, then cataract and fundus evaluation, then glaucoma visit, retina investigation. Then again they had to wait for me with me to have another talk. 4 hours of waiting time. Any alternate thing, there is going to be 3 to 4 hours. And this I saw in SNAC also, Singapore also, there was a big banner saying you have to wait for 4 hours. If Singapore was not able to find a solution, was there a solution for it? So these are the wasted resources that were there. What I did is ARNCT, Claris imaging for free for everybody. So they get an ARNCT just beside ARNCT, my fundus imaging is kept. Everybody gets it for free. But what it does is there is less turnaround, faster turnaround time, only 30 to 45 minutes, the in and out of patient for routine refraction and any other thing. Even diabetic retinopathy screening, because a 200-degree field of view is there. I can do diabetic retinopathy and send off the patient. So the patients that I dilate are only the cataract patients and high myopes, like more than 2.5 diopter, where there is a high chance of lattice and I need to see the entire periphery. I am getting more premium clients because their day is not lost. All the doctors, all the lawyers, all the judges, all the bank professionals, they come to us now. So our clientele has become more premium because of this. And because of the patient flow, our revenue turnover is like we are seeing more than 20 patients per day we are seeing just because we have a Claris imaging. So it is paying like that. We are doing it for free, but actually it is paying me through the increased turnover. And now the last thing that I will put before I wound up is active calling and patient follow-up. So at 1 week, our call center calls up the patient, asks them how they are doing. They feel that the doctor is thinking for them, but it is actually not for them, it is for us. The patients used to come to us at 1 week, they had nothing. We just see them on slit lamp, everything is okay, they go back, but there is a 2 hour waiting time. Apart from then, that they had to travel a long distance to cover that. A simple phone call, how are you doing? Have you started taking head bath? Are you washing your face? Please do that, otherwise you will get redness or you will get itching or something like that. That assures them that we are thinking for them. It is reduced number of follow-up visits for us, so we are seeing more fresh patients rather than seeing the same patient without any added benefit. Uh, and if they tell that there is some problem, the call center tells them, okay, you come tomorrow at this time. They come, overall patient experience is better. So these are the few value-added services that we have taken up, and I think that makes it premium in a low profit setup. Thank you.
Real smart working, boss.